indicators. So why do we need to learn indicators? Indicators or index indication of given situation or reflection of that system helps to measure the objectives and targets of population that are being identified. So I'll give you some examples. So this is we are studying mortality indicators. And when we study mortality indicators, the reason is that it gives experience of the effectiveness of treatment and also it gives surrogate for excess. That means if you have 10 deaths for some reason, you know that something is wrong there. There is some sign of some disease. And also it gives you comparison in two or more organs at two different types. Okay. Now what are sources of information for this? Sources of information are for deaths and death certificates, clinical records, autopsy, sometimes interview with the parents, it's called doctor autopsy, village recorders, and again we need a record of the population also. Where is the population coming? So you have a record of deaths, but you need a record of general population. Again, the population comes from census, hospital admissions, fixed costs. Like for example, the number of medical students studying in first year in etc. So you have 30 to 26 medical colleges. So that will be the population. How many of them are, say, they are getting some reports of deaths or something? That will be the. So we have certain measures for that. Group death rate, age specific death rate, cost specific death rate, and special indicators the infant and infant mortality. Now, group death rate is the commonest one. And you also have proportional to mortality indicators the undefined proportionate mortality rate, maternal mortality rate, disease specific mortality rate, and case fatality. We will talk about each of these in some detail. First is crude rate, then specific rate, and adjusted rate. Now, crude rate means just what you see on the ground. You are saying 100 people died in a village. It's got a population of 5,000. 100 people died. So that is just 100 by 5,000 but you want specific death rate. How many of them died due to cancer? How many of them died to say road traffic accidents? How many of them died due to some other illness? Due to cardiac problem, due to stroke. That means specific rate. Okay, and then we have what's called adjusted rate. So crude death rate does not account for difference in age, sex. Here, the only thing we need is total deaths, total population over time per 1 lakh. So the example they give 5,000 deaths, average total population 50,000, 5,000 and divided 50,000 into 1 lakh. That is just the crude rate. It does not account for difference of age, sex. For example, the number of men dying in road traffic accidents is more than the women. Because men drive more bikes, maybe more rash, drink more alcohol. But you cannot make a comparison. You have only the crude death rate. So then you have age specific death rate. That is comparing mortality at different age groups. So you can say between 15, under 15, how many people died in India, how many people died in Pakistan, how many people died in USA or whatever. So this can be used to calculate lag tables to create an age independent measure of mortality. This gives a depending on you know the average Indian lives for so many years. That is the average American lives for so many years. The average Japanese lives for a longer time. Okay. That's why you can compare mortality different ages and also in the same age over time or between countries and ages. So like for example, this is USA figure, 1965 1991. The crude rate per 10,000 94.46, 65, 84 point something in 17, 1975 becomes 88, 1980 becomes 87, 1985 again 87, 1991 which is 85. But overall, since 1965, the death rate has increased. The crude death rate. Then let's just cost specific mortality. Deaths by certain disease select subgroup in this given year. Divided by total mortality cost in the same subgroup. So, for example, 50 people died in the particular village, out of which 20 people died due to road traffic accidents. So 20 divided by 50, total mortality cost. Okay. 10,000. So 20 people are trying to do calculations divided by 50. This is total number of deaths. In the same, that will be the cost specific mortality. Then case fatality. Total number of deaths due to this particular disease by total number of cases due to the same disease. Now this is interesting because this gives a measure of the killing power of the disease. Okay. Why was COVID so common? You had number of deaths was quite high. Number of cases also quite high. But on the other hand, something like say measles is not that much, but some other disease. So this is a killing power of disease. Used in infectious disease like cholera, measles, etc. And here again there is a difference in aging, host and environment factors. This is closely related to prevalence. So ideally, prevalence that was more number of deaths than the cases. Okay. So say for example, chickenpox. How many people die of chickenpox? Very few. But number of cases will be high. But if the disease is quite fatal, the number of deaths are high. Like COVID. But COVID also, compared to the general population, the deaths are less percent. But look at something like say rabies. Rabies is more than a fatal disease. So number of cases will be less, but number of deaths due to rabies will be. See for example, this COVID cases 1,47,000 in 2021. Number of deaths is so much. So case fatality is 1.7 max 14 max that is 1.2. So this is again cost specific death for Google South Africa was research. That is deaths due to for TB divided by total in one lakh. So similarly in this we have we can compare the deaths due to TB in other countries. Philippines 36%, Mexico is 5.1, and Sweden is 0.4. That means more people are dying of TB in this country. Which country more people dying of TB is more countries. More deaths from TB. Yes, Philippines. Philippines got the most of this. South Africa has got over. The rate is less than Philippines. And Sweden has got the best figures. Then you have this same case fatality. Number of deaths by certain diseases in the given time divided by number of diagnosed cases in the same period. That is the second case also. Now we come to infant mortality. Number of child deaths less than 1 year. Less than 1 year, in 1 year. Number of live births. That is the rate or same thing. Number of child deaths less than 1 year. 1 year divided by total number of live births. That is most above that is one is infant mortality ratio. 1 below. We are talking about infant mortality rate. The denominator is total number of live births. Not the total population. So suppose there are 10 deaths and the number of live births are 1,000, 10 divided by 1,000 and 1,000. That will be the answer. Then you have neonatal mortality. Number of infant deaths under 28 days divided by number of live births the same. You have 1,000. Post-neonatal is number of deaths between 28 years of age, 1 year of age divided by total number of live births in 1,000. Now, why are we breaking this up? Due to infant mortality rate, neonatal mortality rate, post-neonatal. Neonatal mortality rate is between under 28 days. The child is just born, the child can get a lot of problems. The child may get dementia, the child gets influenced by the environment, etc. So, the child dies in 28 days, which is why we have a naming ceremony in 28 days. So, previously, very few people used to live beyond 28 days, but now once after 28 days only, the child is okay. Then after 28 days to 1 year of age, the child can die due to various causes, diarrhea, pneumonia, respiratory tract infections. So that is also very important. Post-neonatal thing. Then you have perinatal. Perinatal number of fetal deaths are 28 weeks or more. That's it. plus post-neonatal up to 7 days. That includes the denominator is total fetal deaths plus live births is same. So this means from the time the fetus was viable, okay, to 1 week after the delivery, that is called the perinatal mortality. So we are looking at a period when the fetus is alive, fetus is pregnancy. After delivery, in 7 days, the patient, the, the child dies. That is called perinatal mortality. Okay. Now, this is another thing. Maternal death. What is the maternal death? The death of a woman while pregnant or within 42 days of duration of pregnancy. In respect to the duration of center pregnancy, from any cause related to or aggravated by the pregnancy or expected, not from accidental causes. So, if a woman is crossing the road, there is and she gets struck by a car, that is not a maternal death. So, the number of maternal deaths divided by women of reproductive age, 15 to 14 into 1. This is both the obstetric risk and the frequency which the women exposed to this. So, these are the common terms we have to learn. Again, same thing, I'm repeating, 1,000 live births. Maternal mortality is based on 1,000 live births. All these things are based on 1,000 live births, not the median of it. A pregnant woman dying in a road accident is not considered maternal risk. A pregnant woman dying of some infectious disease not directly affected a pregnancy is not considered as a maternal risk. Suppose she's got, say, she's got chickenpox. It has not affected her directly. That is not, will not be really nice. It will not be considered maternal risk. Why? Because it is not affecting her pregnancy directly. Similarly, a woman dying in a road accident is not considered maternal risk. So this is again US figure. Now there's a decrease from 22.3 to 18.6. But again, this is we have in India, we have different groups, different culture people. Here also the rate for black women is 50 per 1 lakh diapers compared to 14.5 white women, 12.4 for Hispanic women. So black women there they have higher deaths. The reason is that many of them are COVID from America is very high literacy. They are underprivileged, blacks with that. Some of them do not get access to health education. This is why this thing is actually happening. So this is US figures. 1,205 people died of maternal causes in the United States. 861 in 2020, 754 in 2009. So if you compare the maternal mortality rate, 2021 it is 32.9 deaths for 1 lakh births, compared with 23.8 in 2020 and 20.1 in 2009. So 1,205 divided to 1 lakh population becomes 32.8. So again, in 2021 for non-Hispanic black women, 69 deaths, 2.6 times the rate for white, non-white Hispanic whites. It means those who are not Spanish and non-white, they are having a rate greater number of deaths. Rates of black women are higher than rates of white and Hispanic. That means Spanish. So here, in 2023 we had 174 deaths, but still this is quite high when compared to the Hispanics. In Kerala, we had 19 to 1 lakh diapers. This again was from the source of sample estimates, and actual estimates say about 29 to 1 lakh. So this is attributed to fewer childbirths rather than a rise in pregnancy. So if now numerator is less, obviously unless a child is born, you can't get about that rate. So fewer childbirths than a rise in maternal deaths. And West Bengal is more than 100 per 1 lakh, compared to national average 97 according to various schools. Okay. Just take the West Bengal figures. So what is high MMR mean? More people are dying due to pregnancy. Lack of awareness regarding proper healthcare, lack of proper healthcare, transport and finance issue. Transport and finance issue in the sense, if she knows she has to go to the hospital with the गाड़ी नहीं पहुंचती, people जाओ, doctor से कहते, how will she go? Yeah. And the advanced pregnancy, some women go to how will she go? Second thing is, she not go to the doctor, she has to get a vaccine. There is a finance factor. Highest or marginalized communities. Commercial food is the most, they will suffer the most. And this again, the biggest problem with the hospital labor. Suddenly the labor pain starts. Patient has to be rushed to the hospital. गाड़ी अंदर थे डेली वाली और गाड़ी अंदर वर्षा जीवन करते टाइम लगता है ठीक है what happens in this golden period she lands up having the child next few but still this happens so this is common things I remember I needed the health system country developed countries like USA UK and all the IMR also indications of maternal and child health services like Bihar Jharkhand have IMR and IMR, whereas Kerala has a lowest number, closest to USA and UK. So again, this is a high name. This means also unmet needs in sanitation, medical care, nutrition, education. Also poverty, malaria, malnutrition, underdevelopment infrastructure, inadequate healthcare. All this in that these developed and developing countries. Afghanistan has got the highest number of 110 per 1,000 live births. Africa has got an average of 68 per and compared to US has got only 5.6. So, out of 1,000 live births, only 5.6 time. Whereas Afghanistan, out of 1,000, 110 times, 10%. So, that's the situation. Now, here again, it's not that nobody dies in USA. 20,500 deaths in USA, infant deaths. They died due to birth defects, preterm birth, sudden infant death syndrome, malnutrition, which is like car crashes, maternal pregnancy complications. So, this is the figures of 2022, the cause of infant death. Okay. Infant deaths means deaths occurring within 1 year. So, in IMR here it's 20, in India it's 25. And that's around 24.97 per 1,000 live births, but still we have a decline, but still the decline is to go even further. So the major cause of IMR, prematurity, low birth weight, pneumonia, birth asphyxia, birth trauma. Then you have other non-communicable disease, diarrhea disease, and if known or indefinite causes, congenital abnormalities, sepsis and serious infection. Fever unknown also. So the commonest is prematurity and low birth weight followed by pneumonia, followed by birth asphyxia. So 35.9, 16.9, more than 50%. And plus we add this 60% are due to these things. That is prematurity and low birth weight, pneumonia, birth asphyxia and birth trauma. Again, other causes are general causes, malnutrition, sanitation, organization, backup, breastfeeding, limited access to healthcare, normal amount, disadvantaged communities, and those staying in hard places. So this is there has been a difference in the rural area and the urban area. Urban area is slightly better off. Okay. You have India has got 32 different mortality rate. Rural area is 36, urban is 28. So if you look at the figures in some states, Nagaland is very small, Gujarat is less. Kerala is a fairly big state, but it has got a very low risk. On the other hand, states like Madhya Pradesh, UP, Assam, they have very high IMR. Now we have the under 5 mortality rate per 1,000 live births, number of children under 5 years, divided by the total live births, then multiplied by 1,000. So if 500 number of under 5 deaths divided by total number of live births, the example is if 500 children die out of 10,000, under 5 would be 500 divided by 10,000 into 1,000, which is 50 per 1,000 live births. So in India it was 32 per thousand live births in 2020, but it showed a decline from 2014, it was 45. We still need to go. So this is the same thing. So this gives an idea of the UNICEF report they asked for this. Five countries, India, Nigeria, Pakistan, they have the maximum, the under 5 proportion mortality, number of deaths occurring in under 5 age group. It includes both infant and child mortality. So according to World Bank, it was 23 plus 18. 19 was 34, so it's increased. So India has got its targets fulfilled. 23 deaths per 1,000 live births for under 5 mortality, 16 deaths per 1,000 live births for delivery mortality, and 10 deaths per 1,000 live births by 2030. So this is the same thing to global and all. So we are showing a decreasing trend. But 200 trend is not the one trend, but still we need to move further. Now this is the Millennium Development Goal is related to under 5 child mortality. Now Millennium Development Goal is something which is set up in Geneva, and the target was 42 per 1,000 live births by 2020. We achieved it of 43 per 1,000 live births and 13 as per 2016. So we have achieved the Millennium Development Goal. Target was 42. We got better. So we've now this was again the target under this was to reduce mortality rate to 140. Taking a baseline of it was 568 to 90, so it's now reduced to 140. Now we are what we are having is 167. Okay. So 167 is our figure. It was 212. It's now showing 167. So again this figure also we are having a is showing a decrease. So this is how the Millennium Development Goals were done before the millennium. But then the UN said, let us make this sustainable development goals. This is more likely sustainable. So by 2030, aim to lower the global maternal mortality rate to less than 70 deaths per life. Then by 2030, again, eliminate preventable deaths from the children under 5 years. All countries should try to decrease developmental mortality at least 12 per 5,000 lives and under 5 to no more than 25 per 1,000 lives. And by 2030, eradicate AIDS, tuberculosis. So this is what is being done under the National Intervention for Police. We have tried to introduce countries, including Aishwarya Bharat Service, National Healthcare Program, and so on. So in conclusion, we are IMR and IMR reduced significantly, but still to attain sustainable development standards. Under 5 has done mortality is done better as the sustainable SDG standards. So once again, I'm just going through the figures. Maternal, mortality death, number of maternal deaths divided by total reproductive age group. It's a risk of mortality in fertility. And here are the figures from other countries. Nepal 220, USA 90, Pakistan 188, Bhutan 183, and other it is 212. So this is where UK, Japan, USA, and China. They are not quite. Even Sri Lanka is a very small state. They are not very good. Then, as I said, this trend is showing a decline in mortality. Very good. So this is the what is the stillbirth is up to birth. This is stillbirth. It's a common tension for all parents. Maybe the doctor and the child will go normally now. So previously there should be a lot of stillbirths. Then after birth, from 18 weeks to 7 days, that is called perinatal. And from birth to 7 days, it's called pre-death. It's up to 28 days, it's called perinatal death. This was called early late neonatal. And from 28 days to 1 year, it's called a post-neonatal. So this is the difference of between child mortality. Abortion. Termination of pregnancy because the fetus is high. Late fetal death. Death prior to the complete expulsion or extraction from its mother or product of consumption at 28 weeks or more gestation. Stillbirth is a baby born with no signs of life or 28 weeks. Or death, there is also called death during pregnancy is called preterm death. Death during labor or birth is called intrapartum. This is stillbirth ratio we don't take care of it. The baby is born with no signs of life after 28 weeks. So there are the total births plus stillbirth. So current stillbirth rate is 4, husband is 5. Target of stillbirth rate is have a single digit. So this is then same thing perinatal. What are late fetal deaths and early fetal deaths? Divide the total number by births. Here the estimated fetal weight is 28 weeks and minimum weight of 1000 grams at weight. So why is it important? It's important to know what is the effect of other factors on this. So again, we will same thing with neonatal mortality. Most vulnerable type for child survival. And here the focus is number of deaths, that's a 28 days in a year. Divide the total number of diapers in 1000. Currently it is 23, it is not 70. Target is 60. As per national reports, it is 70. And as per this, sustainable development goals, target is 12 per 1000 and the rate is about 30. So maybe you might get that. Post-neonatal mortality is between 28 days to 1 year. Here, there are a lot of factors, exogenous factors, environmental social factors, also medical factors like diarrhea, respiratory infection, malnutrition, or disease. So this is again, IMR we talked about it. Number of deaths divided by total live births, 1000. Here, this accounts for 10%, 0.5% deaths in India. Current IMR is 32. And we try to bring it by this is a target in 2030 to 28, but it is not. So here child mortality rate within number of children below 5 divided by total number of live births in 1000. Current under 5 maternal mortality is 37. So again here target is by 2030 make it 25. 1 to 4 year mortality is different. 1 to 4 years, infant mortality is always different. Number of children is 1 to 4 years. There are a total number of children, the age between 1 to 4 years. Remember here the denominator is not the number of live births, the number of children aged between 1 to 4 years. So we have differences about states. So we have differences of 1 to 4 year mortality of states. Maternal mortality of states. Like for example, Assam is not very high maternal mortality. Kerala is not a very low mortality. West Bengal is something between. Uttar Pradesh is not a very high maternal mortality. So among the better performing states, we have Kerala, we have Tamil Nadu, and we have Maharashtra also. Then this is a newborn maternity. Again, we have data doing very well, but we have states like Madhya Pradesh, Odisha, and UP, which are spoiling the figures. Data is only one little bit more active. Here it is 23 to 21. And again, here there is a declining trend of this. The total is total violent. From 50 it is dropped out to 32 to 2018. Now it is even less. So we need to bring it on to baseline. Similarly, the rural areas also, it is same. So both the all rural and urban are both showing a declining trend. Okay. So I hope you have got to know what are the different types of data. Remember all of them with the factor the denominator is amplified as number of so this is what the formula once again. So let's go to the first is amplified. Number of amplified heads divided by total number of levels. 2000. That is the amplified mortality. 2000 levels. Then maternal mortality number of heads with pregnancy divided by 8 levels. Okay, so here again we are going to the figures. Number of deaths, that is maternal mortality is number of deaths divided by total people age group into 1 lakh. That is the maternal mortality rate. So that is being reduced with the reducing of time. Then comes your infant mortality rate. Number of babies into 8 fetal deaths plus 11 deaths divided by total live births. So if you add 1000, then mortality rate again. Now it is total live births. Number is showing below 28 years. Post-neonatal mortality is after 28 days to 1 year. Total number of deaths divided by total live births. The IMR number of infant deaths divided by number of live births. So this is what IMR child mortality and infant mortality number of children under 5 years divided by number of live births is equal. 1 to 4 as the name says, between 1 to 4 number of deaths divided by number of children, not live births. Live births come only the previous one. This one is children below 1 to 4 years. So I think that's all I can do.